Psychology, music. Okay, so you're going to start at 0 naira, and you can choose to walk away at any point with your earnings. But again, there will be stages that are confirmed. If you get up to that level, you are sure to walk away with that amount, even if you fail the next question. Okay, so we're going to kick off with question 1 for 500 naira. Okay. All right, I can't get you. A.
Yeah, just symmetry. Just symmetry.
Okay, so just to assist you, even though it's not what we would normally do, but again, I want you to think about the scope of practice of the UAP. Remember, with the UAP, they can only carry out standard unchanging procedures. So again, those routine procedures. Again, I'm going to have you to rethink and give me your answer.
So what do you say?
Again, remember with the UAPs, they can only carry out standard unchanging procedures, those routine kind of procedures. So again, I'm going to allow you give me your final answer.
Okay, my final answer is blood pressure.
Blood pressure. Okay, so let's look at if you're right or wrong. Okay, so congratulations, even though you started on a shaky feet, but again, you always want to remember on the Nclex, your scope of practice, especially with the UAP, you can see stable vital signs here. So that's what you want them to do. You know, those are standard unchanging procedures. Again, with the RN, you don't want to delegate what you can eat. So again, you don't want them evaluating. You don't want them, you want the RN evaluating, you want them assessing, and you want them teaching. So that's your eat. Do not delegate what you can eat. Okay. So again, remember, you've won 500 naira. You can choose to walk away with the 500 naira, or you might choose to go on to question 2 for 1,000 naira.
Question 2.
Okay. A.
My answer is A. Yes, contact precaution.
Is that your final answer?
Yes.
Okay, so let's see if you are right or wrong. Okay, congratulations, you are right. So again, with me, what I do is with contact precautions, I kind of use Mrs. We. Again, when I think of Mrs. We, you can see enteric infection there. One example is your Clostridium difficile. So again, you want to use Mrs. We to remember those organisms that require contact precautions. You can use Spider-Man. When I spell out Spider-Man, I remember Spider-Man is kind of dropping from the roof. So again, that reminds you of your droplet precaution. And then again, there's the airborne precaution. And I remember just like your MTV, which is on the airwaves. So again, I remember that's my airborne precautions. Okay, so well done. Again, remember you can choose to walk away with this 1,000 naira. I will transfer it to your account now as we speak if you decide to take off, or you can choose to look at question 3 for 2,000 naira.
Yeah, question 3.
Okay.
C. Answer C. My answer is C.
Is that your? Okay, so again, before I ask if that's your final answer, again, what technique are you using when you are determining who you want to see first? Again, most times I kind of think of it this way. I want to see the client who is most unstable. For a client who just had surgical repairs, yes, 4 hours looks close, but again, think about which of them is most unstable. Read into the options. What are they trying to tell you?
My final answer is C.
Okay, so again, I'm just going to be on your side. I'm going to help you by taking away option B and option C as wrong options. So again, you are left with option A and B, just to make it a whole lot easier for you.
Answer
so it's between option A and option D, between the client with the laminectomy and the client with the gastric tube. Which is your final answer?
A. My final answer is A. My final answer is A.
So again, let's talk about the client with the gastric tube. Where do you see clients having to? When do we need to insert this tube in our clients? What kind of conditions or cases would you see us using your gastric tube?
Okay. When the patient is having difficulty swallowing.
No, so this will be kind of a tube that we use in clients with kind of liver cirrhosis. You know, when they start having this varices, those varices in their esophagus and in their stomach, to kind of pass this tube to kind of press on those varices so that those veins, so that they don't start bleeding from there. So again, with this information, knowing that this client is at risk for bleeding, which would be your right answer? Option A or option D?
Option D. D. My last option.
Option what?
D.
I already said option B and C are wrong. And you are left with option A and D.
I like D for dog. D for dog.
Okay, so that's your final answer, right?
Yes.
Okay, let's see if you're right or wrong. Okay, so again, that was a narrow escape. So you want to use all of these techniques that we teach on the course, especially with your ABCs. You can see that option D represents a circulation problem. So again, when I think about, so that's your esophagogastric tube, and you can see it has this balloon, the esophageal balloon, and then there's a gastric balloon, which we inflate, and it kind of presses on these those varices that you have, your esophageal varices. So those are your esophageal varices. So when we put in this tube and we inflate it, it presses on this, and again, we use it in clients with liver diseases like your cirrhosis of the liver. So this balloon compresses those bleeding blood vessels in the esophagus and in the stomach. So again, you want to apply those ABCs when you have priority questions. Don't just jump at a diagnosis or focus on the timeline like you did. You want to look at what those procedures the patient has gone through, what the disease process, what the Nclex is trying to tell you. Okay, so you've just been having narrow escapes. At some point, you might have to be on your own. I'm just trying to see how much I can prop you. Okay, so again, I forgot to ask you, would you like to go with this 2,000 naira, or you want to look at question 4 for 3,000 naira?
Question 4.
Are you sure you don't want to take off with this 2,000? You've not been having a good ride instead of going home empty-handed.
Let me try question 4.
Once I play question 4, you are going home with 0 if you don't get the answer right.
Let me continue.
Okay. Question 4.
Answer B.
Answer B.
B for ball.
Is that your final answer? Is that your final answer?
C is my final answer.
Which is your final answer?
C.
Again, is that your final answer? Remember the Nclex, you can't just be jumping from one option to the other.
Yes.
Again, is that your final answer?
My final answer is B, the first one. B for ball. B.
You've gone back to B again.
Yes.
Okay. Again, I'm just going to let you be on your own. Tony, let's see the correct answer. But if you didn't choose B, which other answer would you have chosen?
C. B or C.
Okay, so let's look at the correct answer. Okay. I'm sorry. As if I knew. I was begging you to take up with what you have gotten. But again, let's still review this reading. Again, look at the readings. If you look at the QRS complexes, what do you notice? You'll notice that they are close together. So again, that in itself tells you that this must be a fast reading. So I know this is a tachycardia. Again, what kind of tachycardia would this be? Again, just by looking at the QRS complexes, you can see how wide they are. So that tells me this is a ventricular tachycardia. Again, if I look at the Nclex, the question I have before me, they say this patient has no pulse. So again, this no longer becomes a ventricular tachycardia. It becomes a pulseless ventricular tachycardia. It would have been a PEA if it was any other organized reading that was not generating a palpable pulse. Again, so if I had any other reading that was not a ventricular tachycardia, then we would have said it was a PEA, a pulseless electrical activity. Again, there's no way it could have been C, because with your ventricular fibrillations, there will be no discernible P waves. There will be no discernible QRS complex. But on this, I can see some QRS complexes. So again, you won't see that on your ventricular fibrillation. So again, you've come to the end of the road. We are still looking for who can win our 1 million naira. So again, I want to say thank you for playing. Even though you are going empty-handed, maybe wish you better luck next time. Thank you very much. Again, if you are watching, if you think you can win 1 million naira, send us an email and we'll put you on the show. Okay? So thank you.
Can I reply again? Can I send email and reply again?
Well, you can, and we'll see what we can do about that.
Okay.
Okay, then. Thank you very much, and have a